That's my sort of patient and I want to be like a six-story area outside to do everything. I mean, everything
I was able to contribute today in a way that puts across what, as a charity, we are doing for people that suffer from RA and for carers that look after them. And I hope that what we've managed to do is to show them that they're not alone out there, that they can contact our charity and get all the support and help that they need, and that we are trying at all levels of the political sphere, from politicians, Department of Health, right the way down to the localities, to try and influence the way that their healthcare is delivered to the betterment of the patient.
I hope I've been able to talk about integrating, say, all aspects of rheumatology care into a central package, say, to make the patient part of the team and indeed expand the team. Not just a doctor or a nurse, say, looking after a patient, but involve physiotherapy, occupational therapy, podiatry, and all of these things, which, in fact, some years ago used to be part of the package of care. But we've become obsessed with the idea of pathways of care, and that's kind of fragmented and diffused the access points to care. And I'd like to see all of that brought back, and that's what we've been discussing at our table for the last 10 minutes or so.
Well, I hope I've been able to contribute some of the challenges facing PCTs trying to design services for entire populations with rheumatoid arthritis.
Well, as a hospital consultant, I've been able to give some of my experiences about how I've involved patients in developing our services.
I think I was able to contribute quite a unique perspective because I'm from a clinical background and now doing engagement full-time as a job. So I think it, provided a unique kind of aspect of looking at both aspects of the way the patient's journey is, as well as looking at it from a commissioning point of view.
Well, hopefully I was able to contribute my experience, particularly in running an organisation that's gone through very difficult times and with a complete loss of public engagement and involvement.
What do you know what I mean? Yeah,
What I've learned today, I think, has been quite interesting. I have come with concepts of what I think commissioners might feel or healthcare professionals might feel about working with patients. I have had some positive input from people today that I've heard, but also a couple of areas of concern. And I would really encourage NHS organisations just to sit down and have conversations with patients, just to understand very simple things that are not cost huge sums of money to probably instigate, but just ask them how it actually was for them. And they might be surprised that the things that maybe need to change are so small, certainly don't cost a lot of money, but could make a big difference to the patient.
I've learned that there are areas of management that, again, need to be integrated with what we do in the clinic. So there's been a kind of a mutual suspicion between clinician and management for many years now, which I think is unhappy and unnecessary. If, say, management and clinician can get together and say we're all focused on the same outcome, which is treating patients as best as we possibly can, and it's just a question of different views as to how that might be achieved. If we can get together and integrate, say, our views, there's that word again, integration, then I think we can progress forward together as a team, as opposed to two people who do two different sets of targets.
I think the main thing I've learned is that some of the issues are transferable to lots of long-term conditions, so it's not just things that I can take back around rheumatoid arthritis, but a whole host of long-term conditions.
I'm interested to hear from other people today to find out what they've done and how we can explore new avenues of using patient participation in improving services.
I've learnt about the importance of putting the patient experience first, and as a commissioning organisation, sometimes you forget about the grassroots level of how the patient journey works.
Well, I think the one thing I've really learned from today is all the different mediums of actually getting public engagement and involvement. So certainly one of the big take-homes to me is about using Facebook and other ways on the internet, and really using those in a very positive way to get patient feedback on the services we provide.